Something that's not talked enough in regards to having epilepsy is the connection there is to epilepsy and anger, and also how anti-epileptic medication has a huge correlation also to increased anger. So not only having epilepsy or seizures at a baseline can cause anger issues and has a huge relation to that because of, brain abnormalities and that kind of thing. Also, the medication that is taken in order to regulate and minimize the chance of having seizures can cause an increase in the anger. So I feel like anger in general can be a huge issue with people who have epilepsy, like myself. Some anti-epileptic medication can cause increased anger, aggression, and irritability. So for example, the medication Keppra, as listed above, are known to be associated with aggression in some individuals. And that's actually the medication I'm on for my epilepsy, and it's the only one that has been able to keep, for the most part, my seizures at bay. When you have a medication that works for you, especially specifically against the seizures, when the side effect is anger, at least for me, that it wasn't enough for me to want to switch medications or, try different ones, because that in itself can be such a headache and can cause multiple seizures to come to the surface just because of that gap of trying to find something that works with your system. So sometimes you kind of just have to work with the potential side effects you may get when it's successful in terms of targeting exactly what it's supposed to target, which in this case is to target seizures. And this is a common theme that I've seen, especially in the Reddit forums, is about Keppra rage, that, this widely used medication can cause serious behavioral side effects. And it's definitely true. And I think the lack of awareness in the general public for those who are epileptic, it's huge, because it's very confusing why you're having these extreme feelings, why you're feeling this way, especially if you have other comorbidities. Like I also have BPD and other things, PTSD, blah, blah, that make understanding my emotions and things like anger, rage are like a whole nother hemisphere. It feels like I can't even explain it, the crossovers and how it all affects. It's hard to differentiate also, what is the anger from this thing? What is the anger from that thing? What is this the anger from the Keppra as a side effect? For me personally, I'm not willing to risk having another seizure in order to find a different medication that maybe could reduce some of my anger, when I feel like maybe the Keppra isn't the sole reason for that anger. Although, does it probably help the rage? No. But also at the same time, I'm not willing to risk that. And the thing is, Keppra isn't the only anti-epileptic that can cause serious side effects. They all have variations. And even with those side effects of like increased anger, it's really important to not just stop the medication, because then also you're increasing your chances and risks of getting another seizure potentially. Some doctors will play with the dosages with you if, you are experiencing these things, to try to find a dose that works well with you and your body. And while epilepsy can be associated with anger and aggression, not everyone with epilepsy experiences these issues, but the link is quite complex. And with seizures, it changes the brain activity during them and the brain functioning, which can potentially lead to behavioral changes, including those outbursts of aggression. So it can be caused from the seizure itself, during, after, before, and also from the medication. So it's kind of like there's no total win-win. It's kind of like you just have to go with what helps your seizures the most, with the most minimal side effects. And it's kind of just living with that acceptance, which can be quite hard to accept that as a reality. And to manage that anger with epilepsy, it's really useful to try to identify the triggers in the first place, and using emotional strategies. Like here they suggest smiling and engaging in calming activities. So if you're angry, just smile it out. I'm not saying that doesn't work, but that just made me laugh. And obviously things like having regulated sleep, finding support systems, there's always methods and ways like therapy, counseling, things to kind of help you deal with that anger. But I just feel like acknowledging it and talking about it, that it is a real thing. And I find anger especially can be such a difficult emotion to actually deal with, because Me personally, I don't like feeling angry. It's such an uncomfortable emotion for me, but it's something that is so frequently within me. And I don't know, I just hope that this helped you feel less alone. And epilepsy is such a complicated condition and it sucks sometimes. And I think that's okay to admit.